Once you've identified a definitive IUP, you can further assess for gestational age by ultrasound. There are a few different techniques you can use. This will depend on the estimated gestational age. Early in pregnancy, in the first trimester, you will determine the gestational age using the Crown-Rump length. In your second trimester, you will measure the biparietal diameter of your fetus skull to estimate gestational age. Late in pregnancy, you can use the femoral length to estimate gestational age. In this lesson, we will go over the first two techniques which you may use in an early pregnancy evaluation. Here we're seeing an image of a transabdominal pelvis study identifying a fetus within a gestational sac. Once you identify the fetus, fan through the image until you see the fetus in the longest cross-section. Freeze your image here. Next, take out your calipers and measure from the crown, or the top of the head, to the rump, which is essentially the bottom. If you are in the OB setting or abdominal setting of your ultrasound machine, you should be able to input this measurement to generate a gestational age. In the second trimester, you'll estimate gestational age in ultrasound using the biparietal diameter. To obtain that measurement, scan through the skull of your fetus. You want to hold your probe as perpendicular as you can to the skull of your fetus. Scan through it until you see symmetric hemispheres. Then freeze your image, and using your calipers, you want to measure it from the outer wall to the inner wall of your fetus skull. Inputting this measurement into your ultrasound machine should generate your estimated gestational age.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.